Hi everybody, welcome to Mayo Clinic. I'm Josh Romero, this is Chris Haw. We're two of the PGY2s here. We're really excited to meet you all. We wish we could meet you in person, but instead we're going to give you a virtual tour of what we offer and all the beautiful facilities that we have here at Mayo Clinic.
So let's head on inside and show you guys around. Here we are in the main lobby of the Gonda building. It's a little less busy right now, but usually about 7:30 in the morning, this place is just bustling with patients coming to and fro and moving across campus. This is the atrium of the Gonda building. One thing we really are proud of here is that caring for the patient at Mayo starts when you set foot on campus, and that's really emblematic in this space. When you look around, there's these huge windows in the atrium that let a ton of light in. Behind me, you can see some artwork all throughout this space. And even downstairs, we have a piano, and there's always some music to really take care of the whole patient and consider their needs.
Here we are on the subway level. And if you're like me, coming from New Mexico, you may be concerned about the long Minnesota winters. Let me assure you, there's a great subway system and skyway system that allows you to get everywhere downtown, has shops down here. You can even in the winter go straight from your car up to the workroom without having to go outside and wear a long coat. So it's great, there's a great system here.
I'm Dr. Julie Witkowski, and I'm a former PM&R resident here and the current Brain Fellow. Welcome to Mayo 14. This is the main location of our PM&R department. First, let's take a look at the resident workroom. This is where we spend most of our time when we're on our outpatient rotations. Here in our PM&R residency, we have 8 people per class, and we also have a number of fellowship opportunities, including sports medicine fellowship, pain medicine fellowship, pediatric PM&R, and a brain injury fellowship. So we hang out in this room and get all of our charting done while we're seeing our continuity clinic patients, working on outpatient rotations, or even just having a meeting. Next, let's go check out the therapy gym on Mayo 14. On the way to the therapy gym, we pass our reception desk. We're very fortunate to work with excellent ancillary staff here at Mayo Clinic, both clinical and non-clinical, that make our jobs so much easier. Next, we're gonna go on in here to the therapy gym. We feel very lucky that this gym is just around the corner from our resident workroom. We also are just down the hall from the physical and occupational therapy workrooms. This makes it really easy for us to ask our therapy colleagues questions and also come see our patients while they're participating in their therapies in the outpatient gym. This is one of our 2 ultrasound injection suites here on Mayo 14. We have a lot of injection opportunities and ultrasound experience built into our residency program on multiple rotations and in our formal didactics. We even have the opportunity to do a dedicated elective during our senior year with an entire month of injections. So that's it for Mayo 14. Next, let's head upstairs to our peds rehab area. Welcome to Mayo 16, our pediatric PM&R area. First, let's take a look at our peds gym. As PM&R residents, we have the opportunity to spend 4 weeks rotating on outpatient pediatrics as a PGY2, and then as a PGY3, we spend 6 weeks on inpatient pediatrics.
Welcome to our EMG lab. We're up here on Gonda 8. We're really lucky to have a robust experience with EMGs. We do about 6 months during our PGY3 year. So it's a good opportunity to get really proficient as well as see a lot of cool cases. One of the things we like about our EMG course here is its unique structure. So we actually get 2 months with the neurology department where we have an educational course, and that really sets us up well because we enter into the next 4 months of doing studies with a really strong and a really good foundation. So not only do we get a lot of volume and proficiency in procedures, but we also get to see some really cool and complex cases just with the nature of being in the neurology department, as well as the kind of patients that we get here at Mayo. Next, I'll throw it over to my co-resident, Josh.
Here we are on the 18th floor of the Gonda building, looking east over Rochester. Very beautiful views and some notable buildings. So one of the fun things about Rochester is we have a lot of fun events here. During the summer months, we shut down a whole city block, and there's an event called Thursdays on First. And there's local vendors, there's live music. It's a great time for us all to get together. They have concerts on Sunday evenings. This is a small town that offers big city amenities, so it's a lot of fun. Also, if you like the outdoors, there's a lot of local running trails by the river, biking trails, so there's something for everybody here. That's what makes Rochester a great place to come.
Now we're walking out of the Mayo building. To my left here is the Gonda building, and right there you can see the atrium that we were just standing in with that beautiful view over downtown. Down the road here is the Methodist Hospital, which is where we do our cancer rehabilitation rotation. And then next we'll move into the Plummer Building, which is one of the more historic buildings that we have here downtown. These are the famous doors to the Mayo Clinic. We have a saying here that the doors to the clinic always remain open. And right now they're housed as the entrance to the Plummer Building, where we actually have a lot of our libraries and our research services. So here in the Plummer Building, this is actually one of 2 libraries at the Mayo Clinic. There's great places to study, to get work done, and then beyond that, the librarians here are just phenomenal to help you answer research questions, do literature reviews, and we also have great media support staff to help you with any kind of posters, any presentations, and other academic endeavors. Now we're going to head over to our Sports Medicine Center.
Hi there, my name is Ike Hasley. I'm a third-year PM&R resident here at Mayo. This is the Dan Abraham Healthy Living Center, or the DALC for short. This is where we will do our sports medicine rotation. It's a 6-week rotation as a third year. We'll take a look at some of the ultrasound procedure rooms and some of the rehab facilities. So our PM&R department has a very excellent, very robust musculoskeletal ultrasound program. This is just one of the procedure rooms. As you can see, ultrasound machine over here. This is where we get a lot of experience with injections, ultrasound guided procedures, diagnostic ultrasound. Over here, we'll come take a look at some of our rehab facilities. This is where we get the opportunity to work with quite a lot of physical therapists, athletic trainers. As you can see, there's quite a lot of space for our patients to be working out, working with the therapists, and basically getting back to their sports and their practices and things that they love to do. Outside of the DALC here, there's a lot of opportunity to get sideline experience with various sports such as football, wrestling, hockey. We also have large events that residents can get practice in covering, such as marathons, half marathons, things like that. Now that we're done here, we will head downstairs and check out the gym. This is where Mayo Clinic employees and their family and spouses can have a gym membership for a very incentivized rate. The hours are very flexible. There's also another location over at St. Mary's. You just use your badge to scan in. There's showering facilities, etc. available for before or after work. There's a lot of various classes offered as well. Now we're here on the 7th floor of the DALC. This gives a very good look at a large part of the campus. This is the Mayo building, and that's where the PM&R department is housed, up on the 14th floor. Next to that, towards the left, is the Gonda building. To the left of that, across the skywalk there, is Methodist Hospital. This is where we do our cancer rotation as a 4th year. It provides a good mix of inpatient and outpatient experience and quite a lot of autonomy.
Hi everyone, I'm Dr. Kayle Noble-Taylor, and this is our inpatient rehabilitation unit on Generos 5. We're going to start off by seeing where all of our therapists work and where our resident room is. We have all of our therapists up here. We just came to the new rehab unit in August of 2019. It's a great new space and everyone is able to work together. It's been really awesome as a resident because we're able to, if we ever have any questions, reach out to our therapists, which are just right around the corner. Now I'll show you guys the resident workroom.
Hey everyone, I'm Dr. Stephanie Clark. I'm a current PGY3. I'm going to tell you a little bit about your inpatient rotations here. So during your PGY2 year, you'll spend a total of 6 months on the inpatient rehab unit. There are 2 teams. We have the inpatient brain and the inpatient spine team. The structure is such that there will be 2 juniors on each. And in the beginning of the year, you'll both have 2 seniors, and then as you get a little bit more seasoned and used to the flow of things towards the end of the year, you'll only have 1 senior with you. You'll also return to the inpatient rehab unit as a 4th year, but you'll be serving in a little bit more of a senior role overseeing the PGY2s. So typical morning, I get here around 7. First and foremost,
I get my desk adjusted. We just got these adjustable desks, which are absolutely fantastic. We all love them in the resident workroom. Next, I spend about 30 to 45 minutes chart reviewing on the computer before going down and actually seeing my patients. After I see all my patients, around 8 or 8:30, we'll have bedside rounds where we'll all go in with a team. This is a great opportunity where we all go in with a therapist and we talk about patients' goals on the rehab unit, what's going well, and what they still need to work on to reach those goals so that they can discharge home. Next is our team rounds where we all sit down at the table with our consultant as well as a nurse care coordinator. This is a great way for us to all sit down together, talk about the patients, and discuss their medical plan for the day. Next is my favorite rounds, which are gym rounds, where typically we all get up and walk through so that we can see what all of our patients are working on and the great progress that they're making. After gym rounds, it's back to the workroom for notes and any admissions if they come, and then home by 5. This is our therapy gym. We come down here after rounds and watch our patients in therapy. We have tons of great therapists that really allow us to observe and teach us. We also have a lot of great equipment, including the 0G and our car here where we're able to watch our patients work on car transfers. It's just been a really great space for us where we're able to collaborate with our therapists, and we really enjoy it. Now we'll head into our occupational therapy gym. This is just really another great collaborative space. We have tons of equipment in here, including some virtual reality equipment where patients are able to practice their drive reaction times. And the therapists also have a space where they're able to work on splinting and making casts for patients. It's just been a really awesome place with lots of great windows, and our patients really enjoy it. This is our pediatrics rehab gym. So when we're a PGY2, we rotate on outpatient peds for 4 weeks. And then as a PGY3, we rotate on the inpatient peds unit where we take care of all of our inpatient peds as well as peds consults for 6 weeks. This is our rehab apartment. So this is where patients are able to practice what it's like to be at home. So they're able to do transfers in and out of a standard bed. And they're also able to practice cooking. My favorite part is when they bake you cookies.
So right now we're standing in this skyway that connects the inpatient rehab unit on Genrose to the main hospital. It's really nice to have this skyway that connects us with the hospital because we still have access to all the consulting services, so we are not standalone. As you can see, that's the main hospital right there, and it's also very close to our parking garage. As a resident, you do have free covered parking. There's even access to the subway system so that in the winter you don't have to walk outside when it's snowing. And then as we keep going, you can see the glass Genrose building where we just came from.
So that concludes our tour. Thank you so much for joining us to see our amazing facilities and learn more about our program along the way. On behalf of the Department of Physical Medicine and Rehabilitation, thank you for considering Mayo Clinic for your residency training, and we look forward to talking with you all more.